Hello and welcome to Pulse Check with Archer Nursing, where nursing comes to life. In this podcast, you give us 15 minutes of your day, and we'll take one complicated nursing topic and make it easy. Ready for nursing to be fun? I'm Morgan, and today we have a special episode to talk about what in the world you can do to actually get ready for your clinicals. Now, if you are anything like me, clinicals were one of the more stressful aspects of nursing school. I mean, it's certainly all stressful, don't get me wrong, but just being in a new environment, not knowing who your preceptor is going to be or how they're going to treat you or what you're going to see, I would definitely go on a little bit of a spiral the night before clinicals. So I have a few buckets of general advice I'm going to offer you and just some practical tips to really get the most out of clinicals, because even though they, for me, were super scary, they definitely were one of the experiences I learned the most from. So I'm going to go over kind of 4 different takeaways that I think helped. Hopefully can be some good practical advice for you. The first bucket is just like reframing what clinicals are and getting in the right headspace. The second is how to prep, doing your homework, knowing the basics. The third is really getting organized with that information. And then the fourth is actually how we debrief once the clinical day is over. So first and foremost, reframing clinicals. For me, I really had it in my head as like this terrifying, scary checkoff experience. Like I was there to be judged and I needed to already know all of these things. But when I reframed it as more of like, I'm going to say learning lab, like just a situation where I knew that I didn't know and I wasn't expected to know. Those nerves, like everyone feels that the night before, it's totally normal. Just shift that mindset from like, I'm here to show my skills to I'm here to learn. Like, I am not a fully functioning nurse yet, and they don't expect me to be. This is protected practice. I'm not in a performance. I'm not being checked off. Like, I'm not getting an ABC grade for this. I am truly here to learn. And for me personally, I had to kind of set intentions beforehand and tell myself specifically what I wanted to walk away with. So, hey, today I really want to walk away feeling confident about a head to toe assessment. Or I want to get a little more comfortable speaking up during report or doing a handoff or, SBAR or whatever. And if I kind of focused on one thing and made it about the learning experience, not about like being assessed and showing off or anything, then I got a lot more comfortable, a lot more open to just whatever experience I was able to learn from. And I definitely got a lot more out of it. So that is my first takeaway for you. Reframe it from like scary checkoff to learning experience. Now, my second takeaway for you is to really do your homework. And I don't mean like memorizing checkoff lists and every bit and bob of a head into assessment or whatnot. I actually just mean like the unit and the really foundational basics. So, know what type of setting you're walking into. Is this, a specialty OB rotation, med surge, whatever? And then kind of go through what are some common diagnoses, procedures, etc for that setting. So just like an overall very broad familiarization with the type of things that you're probably going to see. Some other key content that you can do a refresher on, in addition to like maybe the top 5 or 6 diagnoses you're likely to see in that setting, are also the common medications that we give for those, the common nursing considerations, just those big bucket things that, again, you're very likely to see when you go into clinical. In this bucket too, I would also include making sure you have some type of like prep sheet or dump sheet. Different people call them different things. I always used to call them my brain because that was where I took notes and it was like my brain on paper and I had to have my brain walking around doing my job. But whatever you call it, it should just be a nice, easy template where you can take notes during report, talking to your preceptor, having that, even though it's blank, again, like you don't have to go down rabbit holes and do a bunch of stuff, but just having that like framework, that prep sheet ready to go is going to make you a lot more effective and prepared as soon as you start getting that report and needing to take your notes. So for me, I had like a spot for their name and diagnosis, labs, meds, priority problems, and then I also had a bunch of blank space for questions. I was like, what did that acronym mean? I wasn't following during this point. Whether it's gonna be questions for your preceptor, your instructor, whatnot, just have a space, jot them down as you go because you're gonna forget them by the end of the day. So, recap kind of second bucket of advice I have for you, knowing the basics. Look into what the setting is, that key content. I recommend, the top 5 or 6 diagnoses, the meds that go with that, and just having a sheet, a blank sheet even, ready to take those notes and really importantly, write down your questions. Now, my third bit of advice for you really goes hand in hand with number 2, doing your homework, knowing the basics, but this is more practical, just getting your logistics organized. Let's call this bucket like life organization. You're going to have your uniform ready. That also includes all of your gear, your stethoscope, your shoes, your watch that has a second hand, your name badge, your pen light, your notebook, whatever it is that you need on that rotation. You need to have it packed up, ready in the bag, ready to go. I know most of us start clinicals first thing in the morning, and you do not want to be running around unable to find your name badge that you can't get into the hospital without. So make sure you get all of that ready. I liked to have a little like logistics checklist that had the address of my clinical, where I was going to park. I always got very nervous about parking. And if I didn't leave enough time for parking, then you could be late. If you needed certain things to get in the building, the unit name, the start time, the room you were meeting in, if you're doing pre-conference somewhere, also make sure you know how long it takes you to get there. I have been caught unprepared in more traffic than I planned for. So make sure you're looking at all of those logistic things. And you should be going through this the night before. You've got your uniform and gear packed up. Your bag is ready. Your scrubs are out. You've got snacks. You've got water. You've got your alarm set. You know where you're going. You've got that logistic checklist. Take care of all of that the night before, because when the day comes, then you can really focus on the learning experience of it, like we talked about in bucket number 1, turning it into like a learning experience, not something so scary. These are the things you can control, so control them and get them situated the night before. So we've talked about your mindset, being open to learning, knowing the basics and getting kind of clinically prepared, getting logistically prepared. My last takeaway for you guys to get ready for clinicals is really more so about the end of the shift. How are you debriefing from clinical? In my opinion, this is often overlooked because we're just like so anxious about the actual clinical experience that we don't think about what we're going to do when it's over. But this is really where you get a lot of the most valuable nuggets. So, whether you have a formal debrief with your instructor or not, I think most of us probably do. I still want you to take time, like one on one with you, yourself, and I, to actually think about how the day went. And my really core bit of advice for you guys actually is to make sure you're reflecting on what you did well. It is really easy to drive home and beat yourself up in the car about like, I gave that med late, or I didn't know this, or I didn't know that, or oh my God, I put my stethoscope on backwards. Definitely did that once. So embarrassing. And I beat myself up for a solid week, right? But we also do a million and one things right. And giving ourselves credit for that gives us some positive momentum. And momentum builds momentum. So make sure you start off your reflection with like, where did I not get out of the park today? What did I actually do really well? Then think about something you want to improve. And then think about a question that you still have. Remember to jot these down and talk to your preceptor, talk to your instructor in that post-conference debrief or whatever you guys call it. That really ties us back into making this a learning mindset, like we talked about in our first bucket. This wasn't about you showing off your skills or being a fully functioning, competent nurse. This was about you walking away from that clinical experience just 1% more knowledgeable. So use that time to reflect, pat yourself on your back, and really take those learnings to the next step by continuing to ask those questions. So those are my big takeaways for you guys as we shift into clinical season. Make it a learning experience, know your basics, kind of get your logistics in hand, and don't discredit that time for debriefing. Also, don't forget to give yourself credit for what you did really well that shift. I know clinicals can be intimidating and scary, but you guys have got this. And I promise you're learning so much more than you even think you are. So good luck, and we'll see you next time. All right, future nurses, that is a wrap. If you found this pod helpful, I'd love to continue supporting your nursing journey through nursing school, the NCLEX, continuing ed, and beyond. Archer Nursing has you covered with on-demand video lectures, high-yield question banks, live case study reviews, and so much more. We want to help you master tough concepts and make it fun. So join us over at archerreview.com. Follow us on socials at Archer Nursing for more free nursing tips and study resources. Thanks for tuning in to Pulse Check with Archer Nursing. I'm Dr. Morgan Taylor, and I'll see you back next time.